lot of new developments this week regarding our COVID surge. Let's bring in Dr. Suman Radhakrishna, infectious disease specialist with Dignity Health California Hospital.
Good morning, Doctor. Thanks for joining us. Southern California continues to see record case numbers. We report them daily. We're wondering, is this the right statistic for this Omicron variant at this point? Maybe we should focus on hospitalizations or even ICU beds that are filled?
Good morning, and thank you for having me. Yes, this is a question that all of us are looking at, because the raw number of how many people tested positive or negative doesn't necessarily help us understand what needs to be done with that information. But it's still important, because we need to know how significant the infection prevalence is in the community and what the transmission rates are. But a breakdown such as how many people were vaccinated, how many people were not vaccinated, how many people are hospitalized for COVID, not just hospitalized, but hospitalized for COVID-related complications, would be a much better way of looking at things. And I'm sure it will come over time. And the last, which is most important probably for all of us in our personal day-to-day, is what is the local number in the area where I live. So if you want to dine out or go somewhere, you have an idea of how significant the infection transmission rate is.
And Doctor, we reported earlier in the week that the majority of the people in the hospital with COVID were admitted for actually a different reason. So it seems like a lot of people have COVID, don't know they have it. Are we building any type of herd immunity finally?
Yes, whenever people get infected, they will build an immune response. The immune response is more robust if they are more symptomatic than less symptomatic, but it's a response nonetheless, and it will protect us from getting the same infection again. We do know that Omicron can infect people who had COVID before, the Delta variant or the Beta or the original COVID. So this acts like a boost in terms of upping the antibody levels in our bodies. And so hopefully that will reduce the transmission rate and reduce the significance of COVID in our lives that it has kind of gotten a chokehold on right now.
Doctor, sadly, we had a child die in Orange County because of COVID. It's very rare, but hospitalizations among kids are going up. What should parents know?
So hospitalizations among kids with COVID are going up for two reasons. One is, just like among adults, they're going in for appendicitis or something else. And we are testing every person who's getting admitted to the hospital. So we're seeing more numbers there. And then there is hospitalization for COVID and COVID-related complications. And this is a smaller subgroup. This is, again, more among unvaccinated children or children who are ineligible to get the vaccine. And what should parents be looking for? Any viral infection causes fevers, but if you can't control the fever, if the child is unable to hydrate, so the diaper is, you're not changing the diaper as much, or they're not going to the bathroom as much, these are warning signs. If the kid is short of breath and you're not able to control the asthma, the kid cannot complete a sentence or walk, this is another warning sign. But even before you get there, if you are worried that your child looks more ill than he or she does with a viral infection, call your nurse or your healthcare provider and find out what needs to be done, rather than just rushing to the emergency room and sitting there and waiting for long periods of time.
Right. Yeah, you don't want to be sitting in an emergency room for hours. All right, Doctor, great information. Thanks for helping us out this morning.
Thank you.
Thank you.